Namaste, doctor.
Namaste.
Doctor, what are the changes we can observe in the primitive stage of treatment of any autistic child, doctor?
Okay. In the starting of treatment, as we are saying that diet has to be restricted. What are the diet that we need to restrict? I'll just read out what happened after the first stage of treatment. Means before coming here itself, because 21 days is our treatment protocol. Before that itself, we will start 5% of what we are going to do. That's what I just read out one of the patient in Bangalore. They have met me on 22nd of September 2024
Okay, doctor.
till 20th of October 2024. That means 1 month over. So usually what we say is they should write and bring what are the positives happened, what are the negatives happened, what is the concern at that time. This is what the pattern that we follow. I'll just read out that parent has written. They have written that improvement in eye contact while talking or listening, significant increase in listening to instructions, slight improvement in common sense matters, slight improvement in expressing his emotions or feelings, improvement in cycling. That was they were trying it long. Means training was given, but then also he was not cycling. This automatically happens. He is calling by tapping us. Slight improvement in therapies. He is responding verbally. Try bracket trying is got better. He played meaningfully with kids and tried to ask them to play with him through actions. Appetite increased. Greeting people has been increased. His yes bar no has become prominent. You should make notice of that.
Okay.
Waiting patience is increased in brackets slightly. And overall negatives also they have written. Stubbornness and anger issues are there. Passing motion frequently. In school potty, he's passing in the pant itself. Sitting tolerance is better, but slightly decreased, but compared to before it is better. Laughing is there. These are the negatives they have written. So the thing is, we need to know the positives happened within 1 month.
Okay,
It's
doctor.
only because of the 5% of the gut correction medicine that we have given. Nothing we have given for brain. Primary stage we will not give. But with that itself, they are feeling more positives. And what is the negative that the patient had or parent had? It's the stubbornness. You should think why stubbornness will come. How a stubbornness emotion will come. Unless until you are having a decision making or a processing nature, you will not have stubbornness. Actually, before the kid was not at all having any decision making or whatever, he is in his own world. He will not show any stubbornness. He will be in his own world. Parent is giving whatever he need. So this stubbornness is because he started processing. In, for example, in a school, in a classroom, some kids are there, they will be agreeing everything, they will just shake the head. We don't know whether they understood or
Okay.
don't understood, but some certain students will be there, they will be asking questions intermittently,
Mm-mm.
whether that is good or bad.
It's good actually.
Because for asking a question or to show their decision or opinion, they should process first. So because that processing starts, stubbornness will increase. Why stubbornness is increasing? They are not able to express that whatever the processing or the decision came to the mind, they will show as an anger, because they don't know how to speak, they don't know how to express their needs. So it will act as a stubbornness. In that stage, a third person help is needed. In that stage, what we are doing is we are giving a proper biological clock correction. In the sense, their mind should be more sattvic in nature, because at that time also the mind is rajoguna. That is why that stubbornness comes. So that in that case, we will put them into 21 days of a habit creation. What time they should get up, what time breakfast, lunch, dinner, and sleep. And unfortunately, even for me, controlling my kid is a difficult situation. Somebody should control me for that. So what a parent can't do in their home, because I'll be saying the routine what should be, but most of the parents very reluctant to do that, because after certain time their emotions will work. They will follow as per their kids' likes and dislikes. This one we need to break it. Break it in the sense we need to. There are two intentions of staying over here. One is we should train them whatever they dislike. Second thing, we should train how to restrict what they like, because these are the two areas kids show tantrums or the stubbornness to get something or to get rid of something. So unless until they are trained to come out of the comfort zone, will not be happy for a long term. Otherwise also will be happy but for a short term. So if you are working for a long term happiness and making the kid to be independent, they should be out of the comfort zone. This is what in the primary stage we expect, and we need to know whether that line of approach is helping them or not.
Okay.
Namaste.